First, government is doing everything it can to get more COVID-19 vaccines for the entire country as soon as possible. Health Minister Zweli Mkhize briefed members of Parliament's Health Portfolio Committee. He assured them that everything was on track, but that the process of purchasing vaccines was not always a smooth one. Ayesha Ismail has that story.
The minister was quizzed about the timing, pricing and efficacy of the AstraZeneca vaccine. The first batch arrived in the country earlier this week amid much fanfare. Mkhize says when looking at procurement of vaccines, it's important to focus on safety, effectiveness, availability and then pricing.
The question of Pfizer being a high cost, of course, we've negotiated it down, but because they were offering some availability, that was the issue. That made us to look at them. I did say that there are others that we are in negotiations with, but the prices are a bit high, and on that basis we have to really think carefully about what can we do.
Mkhize says countries all over the world were vying for vaccines and most were experiencing delays. But he says that should vaccines become available sooner, the second and third phase would be accelerated. The health minister believed South Africa was not doing too badly with its procurement and was looking at multiple manufacturers.
The process of creating our own vaccination capability is going to be a long process, but what we are eyeing already, we have got Aspen, which is a South African company. Then there's BioVac, which has got it's a partnership with government. That for us becomes the one area where we need to be strengthening our capacity to do vaccines. We have the interministerial committee that's going to be looking at what other initiatives do we need to go into.
He's urging people not to politicize the vaccine issue, saying it's inevitable that there will be challenges and all those will be dealt with. Mkhize appeared not too bothered by rolling blackouts, saying generators would be in place at facilities where vaccines will be stored. Ayesha Ismail, Cape Town.